Hi there, and welcome to All Things Dentistry, where we teach you how to best look after yourself regarding all things dental. I'm Dr. Mpumi Ndwandwe, and today we are talking about how to look after yourself, just the basics of dentistry. And before we get into it, don't forget to like, comment, and subscribe so you can get notifications on all our episodes. So, how do you look after yourself? Just the basics of things: toothbrushing, flossing, using mouthwash, and having all special cleaning aids just to look after yourself better. So what do you need to know as the basics? Brushing. How often do you brush? It's twice a day. We prefer that you brush in the morning and obviously before you go to bed. This is very important because when you brush, we're trying to get rid of plaque and decrease bacteria in your mouth. So twice a day. And then how do you brush? Ideally, it's best that you go and see your dentist so that they can see the status of your teeth and advise you accordingly. But always make sure that in the way that you brush, you are covering all surfaces of your teeth, inside and outside. Very important to do so. This is very important to use the right toothbrush, and there are different types in the market. This is something we will go further into if you keep subscribed to our channel, and you can see that episode too. So toothbrushes, change your toothbrush at least every 3 months so that it's effective and it's actually doing the brushing. And then always remember to brush your tongue. There's a lot of bacteria that hides in your tongue, and also if it's there and you don't remove it, it plays a part in giving you bad breath. So do brush your tongue as often as you brush. And then obviously the toothpaste that you use. Different toothpaste do different things. So depending on your needs, you will need to buy a toothpaste that is then beneficial to you. Do see your dentist to get the best advice in terms of all of the above that I've mentioned. Flossing. Why do we floss? So when we brush, normally we can touch certain surfaces with our toothbrush, but most toothbrushes don't go in between your teeth. So flossing becomes an essential part of keeping your mouth clean because things get stuck in between your teeth, and we don't like toothpicks in particular, but floss is very nice. What is floss? Usually just a piece of string that is engineered to be used for teeth. It comes in different textures, it comes in different thicknesses, and this we will also cover in other episodes. If you keep in touch with us, you'll get to know more. How frequently do you floss? We do ideally like that you floss as frequently as you brush, but I know some of you who've never seen floss in your lives. If you could just do it once a day, it would be great to do so. Okay, and then mouthwashes. Also, whole lot of different mouthwashes in the market. Best to see your dentist to get what's best for you, but mouthwashes are awesome for keeping your soft tissues clean as well. So mouthwashes then get to rinse your cheeks and your lips on the inside, and they rinse your tongue, and they also go in between your teeth. So very nice for keeping your breath fresh and keeping areas clean where your toothbrush and floss can't go into. So your diet also has an influence on how your mouth is kept clean or healthy. So for example, people that smoke sometimes have a smoker's breath, and you can smell that someone is smoking. So that's part of something that we could avoid if possible. And then obviously things like garlic also contribute to bad breath. And just your diet in general then contributes to how healthy your teeth are. So if high sugary foods can contribute towards dental caries, which then contribute towards bad breath as well. And brushing your tongue and the things that you can eat and then harbor in your tongue also influence how healthy your mouth is overall. So your diet is very important. We like fresh foods, we like low sugar foods, we preferably could avoid sugar, it would be awesome. Low acid food or no acid food, even better. So those are contributing factors also to keeping your mouth healthy. And then I keep saying, visit your dentist. If you could visit your dentist every 6 months or at least twice a year so that you can get customized care for you. A dentist can then see what it is that you need and what the status of your mouth is, so that they can best advise you on what is personalized, good dental care for your needs. Sometimes there are conditions that do need extra care. So for instance, if you have braces on or you have a crown and a bridge, those are not normal conditions to always just use an average toothbrush with or average floss. There's specialized care for such conditions, and you might need specialized floss, you might need a specialized toothbrush, or an average toothbrush but used in different ways. So there are aids out there that you can get on shelves that you can then use for those conditions. And again, go and see your dental practitioner to get the best advice on how to look after yourself better in those cases. So again, we are going to be unpacking everything that we've spoken about in the episodes to come. So don't forget to like, comment, and subscribe for more information and to keep notified on all our episodes. This is Dr. Mpumi Ndwandwe. See you next time.